What does capsular contracture feel like? Hang out for the video. We're going to tell you everything to know. Hey everybody, Tim White, clinical specialist with the Aspen After Surgery Center here. We are here today with our patient Jennifer, who has been kind enough to be our model for helping you understand what does capsular contracture feel like, what does capsular contracture look like, and how do we know after your breast augmentation if there's something going wrong, if you have contracture, but most importantly, what can you do non-surgically to fix and address this issue. So let's take a look. The very first sign of capsular contracture is its feel. Capsular contracture has a very specific feel. So using Jennifer's breast, we are going to compare her contracted side with her good side. So the first thing we're going to do is a thumb squeeze. So using our thumbs, we are going to get in here and we're going to squeeze her breast. Now, your fingers, aka your thumbs, should almost be able to touch, almost like there's an inch or two apart. And you can see with our thumb squeeze, we're not getting that close. This is her contracted side, her left side. So test number one, take your thumbs, look in a mirror, squeeze, and if your thumbs do not almost touch with maybe an inch or half an inches of distance, that is how a breast contracture feels. It is firmer. It is like a balloon with a hard shell around it, and that's what stops you from getting there. Now, how do we know that it is or is not contracture? Well, look at what a non-contracted side looks like. So if we do our compression test on her good side, notice how close my thumbs get. Very close. So test number one, sign number one is the feel of the breast implant. Number two, what does a capsular contracture look like? Well, if you take a look, you can see Jennifer's left breast is elevated. So most capsules cause an elevation or an upward migration of the breast. In very severe cases, it's really high, it's really full, and it's really round at the top. So step two is take a look in the mirror. Don't just look at it from the top, you won't be able to see it. Or take a picture of yourself at nipple level and look at the height of your breast. If you see that breast higher at the bottom or higher at the top, that's the second sign that you may have capsular contracture. Third sign of how do we know we have a capsular contracture? It is going to be feeling of the breast. Feeling of the breast is tightness, a sense of the implant is stuck. I feel like there's a pebble in my shoe, but my shoe is my chest. And there may be other signs and symptoms like electrical shooting pain, shock pains, or just some general feeling that something is not right. Now, what do we do about it? Well, here at the Aspen After Surgery Center, we are the developers of a specific treatment here that uses specific technology, hands on some other things, to non-surgically address the capsular contracture. So with Jennifer's course of care, we are going to use some machines, we're going to use some hands-on, we're going to use some tools, we're also going to fit her for a compression garment, and what we're going to do is we're going to get that implant to stretch the capsule, get that implant to drop down, get it level with the other side, and by the time we're done with Jennifer, we're going to squeeze with the goal of this side, the encapsulated side, being just as soft and close with our thumbs as her good side. So anybody with questions, give us a call. Check out the 818 number below. We're going to fill you in on what we do, how we do it, the cost to do it, how and where to do it. And don't forget, we offer virtual evaluations from anywhere in the world to be able to sit down with you on a Zoom call to tell you how to get this treatment, where to get it, and how to, most importantly, prevent having surgery with capsular contracture, because surgical revision of capsular contracture has a very high failure rate and will usually result in the same capsule over and over and over and over again. So hit us up, anybody with questions, comment down below, say, hey, Tim, this is my case, this is what's going on, can you help me, these are my issues. Happy to respond in a DM or give us a call. Tim White, clinical specialist, signing off.